osteoporosis is different than cancer. I think cancer, there might be a little bit more immediacy there, right? There's a little bit more immediacy in and having to manage what's happening. With osteoporosis, bone turnover is a much slower metabolic process. So it's not that you have time to wait and not do anything. You still need to get on it now. You still need to manage your metabolism. Cancer or osteoporosis, manage your metabolism. And do that with support. And so for me, yeah, I prefer it when I have women that haven't gone or trying to do all they can do before medication. But in your case, I think with cancer, I think that the medications maybe, would you say more often than not, are necessary?
Everybody's really different. There's no one form of breast cancer. It really depends on, I have two areas that I talk about. There are components in your breast cancer that you have absolutely no control over. What shows up on your pathology report? How large is your tumor? What is some of your specific genomic markers, your Ki-67? How do you respond to certain tests? You have no control over that. What you do have control over is what you're going to do with your diagnosis moving forward.
My next guest is Carol Lourie. She's a naturopath, an acupuncturist, and a homeopath with over 35 years clinical experience. She specializes in complex chronic diseases such as infertility for older women, breast cancer recovery, autoimmune disorders, and Parkinson's disease. She takes a holistic approach in her work and believes there is no such thing as unexplained illnesses. So, Carol, welcome to Stronger Bones Lifestyle Podcast. It is so wonderful to have you here as a guest today.
Thank you so much. I'm so excited to be here with you and your audience.
Yes, thank you. All right, so let's dive right in. Let's talk about you and what it is you specialize in and what your passion is.
My passion has always been to work with women with complex, complicated diseases who have not been able to heal and attain wellness through traditional methods. And that's my skill set as a naturopath and an acupuncturist and a homeopath. And then many years ago, a dear friend of mine was diagnosed with breast cancer. And in that moment, when she called me up hysterically crying on the phone, I committed to going to every treatment with her. I said, you will not go through this alone. And I immediately began to up-level my skill and my knowledge about breast cancer. Of course, I had studied about this when I attended the National College of Naturopathic Medicine, but applying it real time to a person I deeply cared about was a whole different story. And one of the first things that I really began to experience is that there is an enormous amount of wonderful information in medical oncology, and they are lacking an enormous amount of material on the other side of holistic, natural, and integrative therapies. And so I began to use those with my dear friend. And I remember when we were at UCSF in her oncology appointment, the doctor looked up at her blood work and said, what are you doing? And I thought, oh my goodness, we're doing something. She's really sick. And we said, no, this is what we're doing. And the oncologist said, this is the best blood work I've ever seen of anybody who's in the middle of chemotherapy. And I want all of my patients to be doing this too. And that was the beginning of me specializing in my clinical practice in working with women with breast cancer. And then the need outgrew my ability to see women individually. And I developed an online program to assist women going through treatment and then recovering their health and maintaining reduced risk of recurrence after active treatment has been completed. And that's called Empowered Against Recurrence.
Yeah, this is so valuable because for women who, well, whether or not they want a natural approach, right? So for women who want a natural approach, this is even like music to their ears. But when you enter into conventional medicine and you're working with physicians, there's a certain skill set, mindset there. And you really do need someone like you that has that level of expertise. And even if at the time it wasn't necessarily in your skill set, you said you researched and found out even more. And that's really important because herbs and all of the natural approaches are great too, but we also there has to be that awareness on how to integrate that with the treatments that people are going through. So this is amazing. This is going to be music to a lot of women's ears, actually. to hear this.
Well, thank you. I think you brought up a really important topic, which is you don't want to interfere with medical treatment. And one of the first things the oncologist will say is, I don't want you doing any supplements. I don't want you doing any herbs. And unfortunately, that's not based in science, because there are herbs that actually potentiate or increase the ability of chemotherapy to be effective. There are herbs and supplements which support the bone marrow so you don't get such depressed white cell count. The secret is to know when to stop, how many days to stop before chemotherapy starts, and how many days to restart after chemotherapy has happened. So you can, if you're on a 3-week cycle, which is what most women are, there's like a period of 5 days, 3 days before and 2 days after the infusion in which you reduce certain supplements or you don't take them. But the rest of that time, you can really support your body with herbs and targeted supplements made to pharmaceutical quality standards. That's the other component we need to address, which is when you do your due diligence and you go on Dr. Google and they say, well, you need this product for that problem, you don't really know what company is making the best version that's made to pharmaceutical quality standards. And that means they're third-party tested. So what you see on the label of the bottle is actually in the capsule. So you're not wasting your money or even worse, doing your body harm.
Oh, yeah, wasting your money and also taxing your body that actually needs to either manage cancer or manage the actual chemotherapy to treat the cancer, right? So, and that's what I see with my population too, is women are, I call it whack-a-mole. You know, the whack-a-mole at the carnival where the mole would pop out and you would try to bop it on the head. When you don't have the proper information, you are grasping at straws, so to speak. And so your approach, actually even knowing the timing of when to bring in that supportive care is really important. This is not something that someone should just do by themselves. They really need someone like you that has done your due diligence and research to know timing and the proper herbs to take to support cancer treatment.
It's absolutely true. And there's new research coming out all the time about in integrative medicine and in regular medical oncology care about effective treatments. And very important is testing, which we haven't talked about yet, because so often, if there's something called DCIS, ductal carcinoma in situ, the standard care should be an oncotype. The standard care, in my opinion, if you've had a recurrence, is to do either a Caris molecular intelligence or a neogenomics test. If the doctor wants to place you on hormonal therapy, the standard of care should be called the breast cancer index or the BCI test. And those tests are unfortunately not run too many times. So I have women coming in to see me and they've had a recurrence, and the doctor places them on what I call a, let's see if this works, let's take a guess chemotherapy, as opposed to doing a very specific genomic test and finding out which chemotherapy the person's cancer cells will respond to. And or finding out will a woman benefit from from hormonal therapy with the BCI breast cancer index test. These are standard medical tests that they should be run all the time. Then there's more extensive tests because breast cancer is a metabolic disease. That means there's not just one thing that causes breast cancer. And you can say the same thing for osteoporosis, right? There's not just one thing that causes osteoporosis. There's a relationship between breast cancer and being on hormonal therapy and developing osteoporosis a lot. It's a very extensive side effect of aromatase inhibitors. But for breast cancer as a metabolic disease, there's not just one thing that creates breast cancer. So we need to do a lot of testing. I like to refer that as looking under the hood of your car and really doing a big diagnostic workup, not just saying, oh, it looks like your tires are low, or let's change the oil because it's been a couple months. I want to know what's happening with your blood sugar management. I want to know what's happening with your zinc level and your vitamin D level. And how are you in your inflammation? And there is very specific blood work for this that gives us a very clear baseline. And then we put you on targeted protocols and we can follow how your body is doing as breast cancer is a metabolic disease.
Wow. Okay, that's so amazing. So we've not really spoken to some of the things you've just said. Osteoporosis is a metabolic disease, and that's all. This is all what we're saying. And I also say that we need to look under the hood. I use that terminology. I say you need to look under the hood uh, because it is metabolic from so many different angles. You have to look at what are the contributing factors, and then what you're speaking about. Then you're bringing in a treatment regime. So you've got the metabolism of the person, you've got the cancer, and then you've got treatments, and you want to bring in chemotherapy or whatever other treatments are offered, and then bring in those natural approaches. So you do need to look, it's like making a pot of soup. You need to know how much salt and pepper and how many vegetables and how much stock. It's finding balance, it's internal balance. So that is really wow. I mean, I feel like every woman with cancer needs somebody like you in her life. How do women do this if they don't have someone like you with them?
It's unfortunate. They suffer a lot. And I believe in taking the best of both worlds. I'm an integrative practitioner, what medical oncology offers and what I offer. I think it takes both sides of the coin to get through such an intense experience. Um, and unfortunately, it's not. I've had women come to see me and they've been told, oh, you can eat anything you want, it doesn't matter. Now, that's not medically accurate. That's not that's not true. I mean, there's research that shows that eating the standard American diet literally quadruples the cancer rate. That's a very big statistic to listen to, everyone, right?
Quadruples. Quadruples.
Quadruples the
Wow.
cancer rate. And if you look at Japan, in the 30s and 40s, the culture and the country of Japan had not been exposed to what I call Western or American foods. They were isolated. They had their soy, beautiful, organic, non-GMO soy products. It was a plant-based diet with little bits of fish, right? The Westerners came into Japan. They had almost zero breast cancer. And then as the Westerners came into Japan and the Western diet influence impacted the Japanese culture, their breast cancer rate skyrocketed. So that's a very clear statement of how does nutrition influence cancer rates.
Oh yeah, and
The
nutrition.
Mediterranean diet, yeah, I'm sorry. The
No,
Mediterranean diet has very low cancer rates also.
yeah, I mean, same thing with bone health, with osteoporosis. We need the two things that are going to build bones are the nutrients. So you have to bring in the nutrients, the protein and the amino acids, vitamins and minerals, and then you have to apply the forces to build bones. So, yes, diet is so huge. And that's really an area that I don't think Western medicine, I'm not sure how many hours or how much time actually physicians spend in nutrition. I think it's a very small section. So it's really not something yeah, it's really not something that they're trained in. And, I always look at it like with Western medicine, we have this really narrow minded approach, or really narrow approach. It's almost like we look through a microscope. We go in and we're looking at this area here. But what you're doing in your work is you're actually looking at the whole person. And you're looking at, yes, we need to target the cancer, but then we also need to support the human. And we also need to not only support for the treatment, but actually even for the cancer itself with food. And I know that I've heard that cancer cannot survive in an alkaline environment. It needs an acidic environment, and cancer thrives on sugar, not just the white
Absolutely.
stuff, but also things that turn into the white stuff quickly, right? The really high glycemic foods, or so I'd love for
Simple
you to.
carbs.
Mm-hmm. So yeah, food is medicine.
So I'm glad that you brought that up because in 1918 actually a German scientist by the name of Otto Warburg discovered that cancer, given a choice for energy, either oxygen or glucose, it chooses glucose, even though it has to work twice as hard and gets much less energy molecules or ATP, substantially less. That was then named the Warburg effect, and he won the Nobel Medicine Peace Prize for that in 1924. That whole research was lost for many years, but now it's come back. And it has had a resurgence in this philosophy of cancer is a metabolic disease. Now, unfortunately, when you go into the regular oncology office, they don't say, hello, I'm sorry to tell you this, but you have breast cancer or whatever cancer, ovarian, doesn't matter what kind of cancer it is. Cancer is a metabolic disease. No regular oncologist is going to address you like that. But that's where the beauty of integrative medicine comes into effect. And hopefully, my goal is to reach women throughout the world. This will also be, oh, unfortunately I have breast cancer. Now, there's a couple things that I need to do. One, I need to develop the right mindset to get myself through this path. And two, I want to take the best of both worlds. I want to bring in what the science-based of medical oncology and the research-based of integrative medicine to create a perfect program for myself so I can get through this arduous journey. It's an arduous journey, but I want to come out the other side healthier, stronger, and better than ever. And that's very doable because there's an emotional side of breast cancer that we haven't talked about yet. And there's the emotional side of any chronic disease. Breast cancer is a chronic disease. So you don't just wake up one morning, you have a great life, and all of a sudden you have a medical problem such as osteoporosis or breast cancer or any type of cancer or autoimmune. There's been a lot of clues along the way that you've been too busy to pay attention to. And some of those clues are trauma from the past, even if it's been 25 years ago, unhealthy lifestyle, too much stress, eating on the run, processed foods, lack of really bone jarring and aerobic moving exercise, being in nature, having relaxing time, having something that you love to do that has nothing to do with being productive, but just nourishes your creative soul. And so all of a sudden, it seems like all of a sudden, but it isn't really all of a sudden. It can be developing over a period of many years. You go for your mammogram and, there's bad news. And then you're put into the medical oncology world of we're going to, treat this tumor. But I, as you said, want to treat the whole person. And I think that whenever the chronic disease is, that is your best bet for coming out the other side, healthier, stronger, and better than ever. And we need to go into the emotional component of whatever the diagnosis is, because that's a necessary and so often too missing part of medical oncology.
Yeah, so interesting what you're saying. I mean, that's bringing in this next layer, this whole mental emotional. But even before we get there, what you're speaking about, this whole journey to disease, right? That's what I say when I work with women with osteoporosis is you did not just wake up with heart disease, cancer, diabetes, osteoporosis. You had the dysfunction before that. And that's what functional medicine and integrative medicine is looking at is where were you before and how do we heal this place before you get to that disease state? I speak with women quite often because working with osteoporosis, a lot of women maybe have come there because of cancer at some point in their lives. And it's this journey. You end up into this disease state. You've got to realize that when you came to the disease state, let's look at what got you here. Let's look at lifestyle and behaviors and how can we implement and adopt the healthiest lifestyle and behaviors to be the healthiest versions of ourselves. So
100%. It's the same journey, right? And I think that we as women get our messaging from American advertising. So for emotional wellness, it's the woman is sitting there, the house is a mess. And what does that mean? The house is a mess. There's dishes in the sink, the beds aren't made, and there's a pile of clothes. Now, when I had a young child, I had dishes in the sink. My bed wasn't necessarily made, and I had clothes sitting there waiting to be folded. I wasn't depressed. That's on one level. But on the other level, why is that a woman's responsibility? Where's the partner? Whether it's a man or a woman, where's the partner and what made her not feel well? But then this commercial, which is where we get her unconscious messaging, she's given a pill and all of a sudden the house is spick and span and she's serving everybody dinner. So as a feminist, where are the people who are helping her? Why is she not sitting there and everybody is serving her, or everybody's participating in this meal together? And we get the same messaging for bone health. It's not about, okay, you're getting older and you're at risk for fractures, but those messages need to come in the 40s. Let's talk about osteoporosis prevention. Let's talk about breast cancer prevention. what can we do as women in our 30s and 40s to take really good care of our bones, as opposed to when you're in your 60s and you already probably have osteopenia, and now here are your drug options. And if you listen to the side effects that they're required by law, some of those side effects of those drugs are not anything that you want to risk, right?
Right. Yeah, it's you know the whole thing about prevention, it's a lot harder to sell prevention. It really is. And in some ways that is what I feel like I do. I mean, I work with women who have osteoporosis or have osteopenia, and I try, especially on social media, to raise awareness to those who maybe haven't received a diagnosis yet. But it is a lot harder, it seems, to sell prevention. And I remember, I think the statistics were 1 in 10, maybe in the 80s and 90s, of women that would get breast cancer. And then I knew that they at one point went up to 1 in 8. That was the last statistic I've heard. And even now, I think cancer is definitely a fear for women, but even more now, I think cognitive decline has become such a fear for women. So, and I say women because it seems that women are the ones that seem to get most metabolic diseases, maybe because we're being expected to be making the dinner, having that clean house, and take care of the kids, like you were saying. But yeah, it's definitely something. It's whatever the messaging is. I'm thinking about my journey of where I am in my life and what I've worried about. But I know that I have that harder time trying to sell prevention to someone versus someone who has the disease. And it's a lot easier to prevent the disease or to not come into disease state than it is to arrive into a disease state. So yeah.
Osteoporosis and breast cancer, they're both a lot like diabetes. And diabetes has this term, the silent killer. You can't see that your bone health is deteriorating. You don't know that your body is pushing cells in an unhealthy way, and the cells have decided to stop paying attention to the rules of stop and go. And you can't see that with diabetes that you're having, your blood sugar is 250 until all of a sudden you're losing sight in your eyes or something, or you can't walk anymore. You go into diabetic coma. So this is where going into your doctor and being educated about, I need this blood work. I want to do a thorough evaluation of where is my metabolic health in my body, and really find a doctor who's willing to run certain tests for you in your 40s. And if you have a history of cancer in your family, especially breast cancer, you need to be on a higher level of screening. And I encourage you to find someone to do some breast cancer prevention education for you, because there's a lot you can do outside of just going for mammograms or ultrasounds or MRIs on a more concerted diagnostic workup every year. There's a lot you can do to keep those cells from deciding to go the unhealthy path. We want to keep them in the healthy path.
Yeah, and the same thing with osteoporosis. There are some functional markers you could look at in blood that are not typically part of a CBC or a CMP. And so I know that when I do blood, or when I plug someone's serum markers into a functional analysis, even the functional analysis of the blood, and I think that's more probably what is the case here, Carol, is that there's the conventional way to look at labs, and they're looking for disease. They are looking for a disease state. And when you start to look at things functionally, you mentioned earlier that there's some symptoms that you didn't just end up here. And so we can look at markers even in serum in some regular blood labs, or maybe you can get your physician to order some other labs. But what I find honestly is that in the functional space, I'm not sure necessarily with in cancer, some of those tests that you were mentioning, but these are usually out of pocket and they're not all covered by insurance.
Well, once you've been diagnosed with cancer, you can say to your physician, cancer is a metabolic disease. Cancer loves sugar. I've been eating too many carbs and I want these tests. And the doctor may say, well, it's not covered by insurance. And my response is, well, it will be if you recommend it, number one. And number two, can you please put in my chart that we've had this conversation? Because if I develop diabetes or something, I want it noted that I wanted my blood work done for my sugar levels to see if I have syndrome X or if I'm pre-diabetic, and that we never ordered the tests. And sometimes that will push the doctor over the edge to order the tests. Sometimes you do need to pay out of pocket, but there are ways of getting these tests through specific labs that are not, you order them yourself, and it's not prohibitively expensive, but we have to look at the word expensive. Expensive is having a recurrence. Expensive is having a family history of cancer and you not getting the right tests, and then this happens to you. So, there's that phrase, an ounce of prevention is worth a pound of cure. I mean, it's a ridiculous phrase, but we need to be very empowered about how we allot our budget for our health care and not expect the insurance companies to sign up because they have their own method and their own path, and it's not necessarily for your health. It's for the treatment of a disease.
Right. Yeah. Treatment and management of disease. And it's so amazing that you're saying this. The other saying that I've heard is pay the farmer or pay the pharmacy. So when I
Mhm.
like buy organic produce, buy supplements, are there ways that women or markers that women could look for that are going to show that maybe one day they have a greater chance of having osteoporosis? Because there is such a strong correlation between cancer and osteoporosis. Some of the medications, there's indirect and direct causes of bone loss with cancer. So, are there some tests that women can run if they have cancer or in treatment for cancer that look at bone markers?
Well, they want to look at their serum calcium, and then there's some, other advanced tests, but that's something that they really need to be in conversation with their doctor about and do a DEXA scan. And a DEXA scan is often run before they start treatment or immediately afterwards. Generally, when you're in the middle of cancer treatment, they don't look at those markers because they're going to be skewed by the treatment you're receiving.
Oh, wow. So, do they do a baseline? If someone was premenopausal, would they do a baseline DEXA going into cancer treatment?
It's a Yeah, it depends how old they are. And it also, if the woman wants it, they would do a baseline.
Okay,
So if you're
that's good.
44 and you're about, if you're 44, you may not be you're going to be put on Lupron for ovarian suppression because you're still cycling if you have hormonally positive breast cancer, and you're probably going to be put on aromatase inhibitor. So you would request a DEXA scan before any of that happened, and they
Oh,
would probably do that for you. And then you would be put on aromatase inhibitors and ovarian suppression with Lupron. And within a year, they would do a DEXA scan probably in 3 years. But if you're working with an integrative practitioner, there are ways of monitoring the aromatase inhibitor dosing, talking with your oncologist so that maybe you can avoid some of the side effects of severe bone deterioration, right?
wow. Yeah, and that would be great. So for anyone listening, getting a baseline if you are going to have going through treatment is very important. Women that come to me wish that they had a baseline mammogram, sorry, a baseline DEXA scan. And this is whether or not they've had cancer, because it is really important because we do know that there is a correlation between cancer and osteoporosis with whether that's the medications or because it's all metabolism. And if we're going to affect our metabolism with some of these chemotherapy drugs, we don't always know. And that's one thing too. We don't always know what's going on in this miraculous body, right? There's not you. That's what's so amazing to me is we cannot say this, we could, there's markers to test, is this getting the cancer cells? But we don't know what's happening over here, 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 and here. And we have 70 trillion cells. So, what is the effect of this medication? And what will the effect be 5 years from now or 10 years from now? And we do see that women that had cancer treatments have a high incidence or a chance of having osteoporosis.
100%. 100%, especially if they're on tamoxifen or aromatase inhibitor. And how that works is estrogen is intimately involved in bone health. And so you are all of a sudden, menopause is a gradual process, right? It takes place over 1.5 to 2.5 years. but you're taking these medications and all of a sudden you're shutting the dam of estrogen off and your body's going, whoa. And that puts you in what I call the speedy path of menopause. So your bone health is all of a sudden going to deteriorate radically and quickly. And so I did a lot of research. There's a combination of three different supplements that I recommend. There's ways of eating. There's the bone jarring exercise, which I'm sure you're supportive of and know a lot about. But I have two different women in 1 week told me that they asked their oncologist, what should I do for calcium? And one doctor said, go over to Walmart. And so I'm not kidding.
Oh
Here
my
is this
gosh.
woman with a serious metabolic disease. She goes to Walmart. That's what her doctor told her to do. And a young 20-year-old is standing there and she says, where's the vitamin aisle that has calcium in? The woman said it's aisle 7. So she's been told by a 20-year-old who to go to aisle 7 to look for something that is critical for her bone health. That is not okay. Somebody else had the similar experience with going to CVS. The pharmacist said, oh, yeah, aisle 5. And of course, this woman didn't know what to buy. She ended up spending $27 and came to see me with this calcium that was calcium carbonate, which is for 20-year-olds. Calcium carbonate is not the calcium that a woman in osteoporosis or is concerned about osteoporosis needs. And it's actually can be harmful for you because it can contribute to kidney stones. So it's a serious, bone health is a serious side effect of these medications and needs to be treated with the respect that it deserves any serious, complex medical condition.
Yeah, and a little bit about what you said earlier about finances and where do we put our money? And when it comes to supplements, quality matters. When it comes to calcium, sometimes it may be ground up rocks that are in a calcium supplement, some of the lower cost supplements. And, if I had to give a percentage of quality of calcium supplementation that I see when I work with women or I do discovery calls and I see the brands they're taking, there's some that are not quite the right quality for sure. So, and then the whole calcium supplementation in and of itself is a whole other discussion. How
Mm-hmm.
much to take if we need it. I run I run functional tests on my clients. So I look for calcium and see if they have calcium in soft tissue. So there's a whole other aspect there as well. And I'm sure that you run labs to look at what is it, beyond conventional medicine labs, when we're looking at from a functional perspective, looking at labs and being able to really individualize and customize each person's approach. And then when you have
That's ideal.
cancer, yeah, and when you have cancer, that's another layer. Then you've got another. I know that when I have clients who have cancer, I definitely work with other practitioners because there's certain herbs you need to avoid, certain, we're trying to stop growth, right? Stop tumor growth. And we have to look at where are the herbs or the supplements that actually may contribute to growth. And one of them that I just heard recently, and I'm not sure if how you feel about this. Someone told me recently L-glutamine is the most abundant amino acid in the body, and
It
many
is.
people are taking L-glutamine for leaky gut, and
Bad
they
idea.
yeah, well, it's a bad idea because there's studies that show that it actually supports tumor growth,
Well,
right?
what it does is, and this is a split philosophy in integrative practitioners. Some people feel it's fine. My group and myself feel not. And as you started to say, what it does, how it helps heal the gut is it increases the cell growth. It increases the stomach lining cell growth. And so there is this philosophy and concern that it can then increase cancer growth. So there are many ways of healing the gut after chemotherapy and radiation, and L-glutamine in my protocols is never in there. And it's interesting that you brought that up because I'm just about to teach tomorrow the second week of my 6-week live group coaching program, and we're talking about supplements. And I have this whole slide that says L-glutamine should not be anything that you're teaching and I explain it just as I did with you.
Yeah, so L-glutamine, and then there's some herbs as well that I was learning about because I have some clients that have cancer, and so I want to do my due diligence and make sure that I'm not recommending anything that could be harmful in any way. So, what are some herbs? There's a couple of herbs that we should avoid if
Well, what
you're,
do you
especially
know
if you're,
about? Let's.
so if hormone specific, if you have hormone specific cancer, right? We got to be careful with maca. Maca, have you heard of maca? Okay,
Yeah, of
so,
course, but I
oh,
don't. I mean, green tea. That's green tea. I don't.
no,
I
not
have women.
matcha, not matcha, green
Oh,
tea, not matcha, maca powder. So maca root powder,
MACA powder.
MACA.
Yeah.
So that I've been told to be careful of. And maybe rhodiola, is rhodiola one that is, no,
Rhodiola is an
adaptogen, yeah.
adaptogenic herb. I don't know. I'm not. Maybe you may know something I don't, but I don't know how it's. What is it? Estrogenic or something like that?
I'm not sure, but I think that that's the whole premises here is that, when they do chemotherapy, it's to stop growth, right? So that's why they do a speedy menopause, as you call it, because estrogen is bone health protective and it's for growth for bones. So it's to stop growth. So whenever we have herbs or anything that could support growth of something versus stopping, and I think that, and what I found, Carol, is there's so much information out there. And
Yeah,
there's research that says this, yes, do this. And there's research that says, no, don't do this. And it can be very, very confusing,
it is.
right? It's confusing for me to research all this, to learn, to hear this, and I ask one person, what about this? And someone says, no, that's okay, or this is okay. So really being as most educated as possible, or really working with someone like you if they're going through cancer and chemo. And I think that it's better not to try to do things yourself. And it is better to learn all that you can to make sure that you stay safe.
I think this is an interesting concept you just brought up because for some reason, you take your car in to get fixed. You don't think you're going to fix it yourself. You go to the dentist to fix your teeth. But for some reason, with breast cancer and for women with cancer in general, they think that they should be able to do this themselves. And this is a skill set that people who know what they're doing spend thousands of hours in class and in and research. And I read PubMed articles every week. So yeah, there's something going on with that, and it's part of the energy of breast cancer. And as a homeopath, there are diseases that have certain energies to them, and the energy of breast cancer and that philosophy is called a miasm in homeopathic medicine. The energy of breast cancer is rush, 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 do, do, do. I have to do this. I have to do that. You're always on the go. You're always pushing yourself. You're making lists. And you tend to be a bit of a perfectionist, which keeps you from asking for help because you're thinking, well, this person isn't going to do it exactly the way I would like it done. So you're doing too much and you're always taking care of other people, and there is very little energy for you to take care of yourself. Now, to recover from breast cancer, that whole thing needs to turn around as soon as possible because that's one of the contributing factors of creating disease. Notice I said one of the contributing factors, right?
Right. So yeah, you brought up, this is really interesting. And this is what happens. So we're talking and we're kind of like, and I think this is it, I'm in my mind and you're in your mind, and we're in our place of inquiry ourselves, right? We have our said profession, we have our passion, for you cancer, for me bone health, and we are learning as much as we can, and we're curious. I also read PubMed articles, and then I also, when I read the PubMed articles, I also look at, was this done on mice? Was it done on men? Was it done on
Yeah,
50 guys
100%.
in
Yeah.
Greenland? Right? Because then you have to, like, what's the validity here? And what am I going to hang my hat on? Is this what we should hang our hats on? But something you said earlier, we talked about the mental emotional aspects of disease. And I think that when you just said that there's something going on with cancer, speedy, 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 I would say the same thing for osteoporosis.
Hmm.
And as you were saying that, what I was thinking is, I think the reason, Carol, is because death seems so much greater with those two. You've got cancer where the fear of death comes so forefront that what can I do? And I got to do it now. And then with osteoporosis, it's, oh my goodness, I might fall and break my hip and die. And so, really, whatever the disease diagnosis is, maybe the greater the fear of death that comes around that diagnosis, cancer being one, osteoporosis another, the greater that fear is, then that's going to create how you go about it and what you do. And so I really think that that's what came up for me when you were saying that. We both are in professions where and what we've chosen to be passionate about, or what chose us, I say that this chose me, really is we got to get to this mental emotional layer. And that, so I'd love to speak a little bit about that, because you brought that up earlier, and the rug getting pulled out from under you when you get a diagnosis of cancer and when you get a diagnosis of osteoporosis is a big quick pull of that rug out from under you. So could you speak to that, please?
100%. Yeah, sure. Um, with breast cancer, one of the things I do when I do an intake is I say to women, have you ever had anything traumatic happen to you? And I had a woman get very upset. And she said to me, well, I have never had anything traumatic happen to me. What kind of a question is that? And I said, okay, let's change the word traumatic to upsetting experiences. Have you ever had anything upsetting experience wise happen to you? And she says to me, oh, yeah, I've had a lot of those. And so she then proceeds to tell me about these circumstances when she was younger and in her teens and in her 20s, horribly traumatic experiences. And so this is where I tell the story of the frog in warm water syndrome. This is true. If you take a frog and place it in warm water and you gradually increase the water temperature, the frog will boil to death because it gets used to the hot water. And unfortunately for women in our society and energetically and whatever, women get used to being in difficult situations and they adapt. And so that trauma gets stored in cells. And even if, as that other woman said, well, it happened 30 years ago, 40 years ago, what difference does it make for now? No matter how long ago it happened, that energy is still there. And then you have maybe a lot of people have gotten sick after vaccinations. Maybe you have a horrible boss that has been harassing you. You're unhappy in your marriage. And as you get older, your ability to adapt and tolerate these unhappy experiences or unwell experiences, that ability goes down, and then the trauma from the cells comes up. And the next thing you know, you've been diagnosed with autoimmune or chronic fatigue, or you're severely depressed, or fibromyalgia, which is a diagnosis of they don't know really what's the matter with you. They've just put it into that name, or cancer. So handling our emotions now, when you're younger and you've had upsetting experiences, putting it on the back burner in a room and closing the door is appropriate because you don't have the skill set to handle it and you are a victim. But as you get older and you're an adult, we need to begin to consciously and actively begin to unpack upsetting experiences and trauma, even if you just want to focus on what was it like, as you said, to have the rug pulled out from your life when you heard the words, no woman wants to hear, you have breast cancer. So just unpacking that and looking at that is a very big deal.
Oh yeah. I mean, I'm a yoga therapist. And so for me, this whole mental emotional layer, like there's 7 root causes of bone loss. We've spoken about a couple of them. I don't know what the number of root causes for cancer, but I'm sure inflammation, stress, those are 2 of bone health. And I'm sure that they're also with cancer as well. Hormone imbalances, mineral imbalances. I'm sure that many of the root causes that lead to bone loss, we could say for cancer as well. But really,
100%.
the stress component, the and as a yoga therapist, to me it's not just this lifetime that you have this traumatic experience or this suitcase of what you have to deal with in this life. It's also your grandmother, your great grandmother, who the grandmother from the 1,000 years ago that had to survive what she survived in order to live, to have the next generation. So that comes with us. But one thing that you said was really interesting as well, when you ask that question to your patient or your client, when you ask the question, have you had any traumatic experiences? She said no. It's almost like we can't admit, we can't own or admit something that we can't use that's traumatic experience. But then when you use different words to describe situations, she told you about one traumatic experience after the other after the other. What is that about us women, that we feel like we have to bear everything, that we have to take everything, that we have to shove it under the rug or whatever it is we do, stifle, put it down? It's really interesting.
Well, it's part of societal messaging from advertising and movies and televisions. And I think it's part of the frog in warm water syndrome. and it's very unhealthy. And
Yes,
it is
yeah.
part of the cancer miasm of not acknowledging that. So it's very upsetting as
Yeah.
to see women, what women have gone through without seeking help.
You know, when I was studying yoga therapy in India, when we studied with a woman that is very big in the cancer world. She had cancer, I think, in her 60s. The conventional approach was going to be, you know, here's the chemotherapy, here's this, we're going to kill this, kill this. And she was like, no way. And so she went to India. She studied with, in one of the greatest research centers in Pondicherry, India, not in Pondicherry, in Lonavala. It's called Kavaila Dham, and they're a scientific research center. And she I'm not sure if she does this currently. This is in 2017. She would have cancer retreats, and it was, you would love it. I mean, if you saw their daily routine with the food and the what they were
Yoga.
drinking and yoga and meditation and just all of it. And so it was just this real holistic approach. But one thing that I learned there's a couple of things that really stood out for me. There was one thing, and she said that it's believed in that their philosophy that cancer is anger turned inwards. And so just an emotion, maybe this word is anger, but might not be the emotion of anger. But even if we look at emotions turned inward or sucking it up or just dealing with it, you know, just so maybe it is that stifling and that lack of self love, self care, self awareness that shows up in the form of disease as well. I mean, I think it is.
I agree. And there's not just one thing that creates cancer because, I don't want to give anybody the message, oh, if only I hadn't been so angry, I wouldn't have gotten breast cancer. I mean, I think we're entitled to our feelings and emotions. And the trick is to not get stuck. And in order to not get stuck, it's very difficult to do that yourself. That's what professional help is for. As an acupuncturist, I like to think of our body as a free flowing river, and the energy is just floating along. And then you get upsetting experiences or trauma or debris, and all of a sudden you get this clunk in the river that's blocked and the water doesn't flow. And then the water that's in that clunk dries up and creates mud. And that in Chinese medicine is called blood stagnation. And that's the beginning of a tumor. So, attending to the free flowingness of your energy or chi on a daily basis is how we keep ourselves centered and healthy. And it is not easy in this society to do that. I mean, even though for those of us who know about it, you have to make a concerted effort to and be very determined to block out that time in the morning and in the evening to do your meditation, to do your stretching, to do your yoga. You need to just make sure you know what you're eating so you're not ravenous and then throwing stuff in your mouth. I mean, there's this pace that we all have, which we just need to like take a lot of things off our plate and realize we're only one person and we can only do so much in a day.
Yeah, it's a lifestyle. It's a lifestyle approach. And
Mm-hmm.
it's about not attaching or detachment. I have my little invisible scissors that I walk around with. And when something is bothering me and I know that I need to just let it go, I really do this. I take my scissors and I'll
I
go
like
like
that.
this, like I'm clipping it, like I'm getting rid of it. I'm getting rid of that. Yeah. And that the thing I said about anger, that's the mental emotional. There's also, of course, the food and the toxins that we're exposing ourselves to, and the self-love, self-care that we're going to give ourselves with choosing the foods or to feed ourselves appropriately so that we manage our blood sugar. We don't let it get to a place where we're ravenous and we won't make the best decision for our body, for our health when we're in that state. Okay, one
100%.
you said one more thing. You and I have not really spoken much about this, but you keep
I
giving
know,
these
but we are in agreement with
it's
everything. We
well,
just
it's
agree with each other.
but
Yes.
it's also the analogies you're using, Carol. I'm a really visual person, and I give analogies all the time that are visual because I want to help people understand. So you gave this whole river analogy with this stagnant area. I say that same thing for the body, for the joints, that we develop cobwebs in our joints. We become sticky, and if you don't take care of sticky, sticky will become stuck. And so just like you'll see that puddle in that, and it's murky, right? It's murky, and twigs will get in there, and foam will be in there in the river.
100%.
It's the same thing with the body. I mean, so that's like, I'm speaking musculoskeletal now, and I'm speaking about joints and bones and arthritic deposits that get stuck. And if you don't dislodge them back into the system to be metabolized, they'll get stuck and you'll get knobs on your knuckles, and you'll get pain in your
Yeah,
joints. So yeah, but then there's the deeper part too. There's the biochemical aspect of that stickiness that could get stuck, that could become a disease or a tumor. And so yeah, those are some of the visuals I use with my clients as well. That's really interesting.
love that.
Yeah, so the three main areas of stress that lead to all disease, right? We've got the musculoskeletal, which we spoke a little bit. We've talked a lot about biochemistry and metabolism, and then that mental emotional, and all three of these are interconnected. And so you really need that whole holistic approach. And I think what is so beautiful about what you do, and I want to say beautiful without it sounding light, because I think that there's a lot of weight to what you're doing here, is that when you get that diagnosis, whether, cancer, osteoporosis, when you get that diagnosis, work with someone that can help you work alongside conventional medicine. So if you are going down the chemotherapy route, and if that's the path that you need to, have someone like you there that's going to bring in this whole balance everywhere else. So balance inside, balance outside, the mental emotional balance necessary, the dietary shifts that are necessary, and that will be supportive of what's being done conventionally. And I would say to some extent, I feel that way about the work that I do with osteoporosis.
100%.
I mean, I prefer to work with women that choose to not go the medicine route, because when you're bringing in something, it's osteoporosis is different than cancer. I think cancer, there might be a little bit more immediacy there, right? There's a little bit more immediacy in and having to manage what's happening. With osteoporosis, bone turnover is a much slower metabolic process. So it's not that you have time to wait and not do anything. You still need to get on it now. You still need to manage your metabolism. Cancer or osteoporosis, manage your metabolism, and do that with support. And so for me, yeah, I prefer it when I have women that haven't gone or trying to do all they can do before medication. But in your case, I think with cancer, I think that the medications, maybe, would you say more often than not, are necessary?
Everybody's really different. There's no
Yeah.
one form of breast cancer. It
Okay.
really depends on, I have two areas that I talk about. There are components in your breast cancer that you have absolutely no control over. What shows up on your pathology report? How large is your tumor? What is some of your specific genomic markers, your Ki-67? How do you respond to certain tests? You have no control over that. What you do have control over is what you're going to do with your diagnosis moving forward. And so there are people who, like, they were stage 0 and they had like a point hardly at all, a very small tumor. And their DCIS oncotype score was, 5%. That person is in a very different category than somebody who had a larger tumor and their onco score was 23. And, so you don't have control over what shows up on this pathology report. So, and there is no one type of breast cancer. That's a misnomer. Even if it's hormonally positive, everybody's is different. You look underneath the hood and you see that the estrogen progesterone percentages are bigger. The Ki-67 is bigger. Their zinc and their coppers are different. Their blood sugar management numbers are different. So there's no one form of breast cancer. And the more knowledge you have, that enables you to have more power with your oncologist and more ability to make hopeful and positive decisions for all the lifestyle choices. How are you going to eat? What type of positive exercise are you going to do? How are you going to manage your stress and your sleep? There is a lot, and you don't need to do it all at once. You can't do it all at once.
Yeah, and there we go again with more lifestyle. And you just mentioned copper and zinc, also important in bone health. And so, as I'm
Oh,
listening to you speaking about all these metabolic aspects of cancer, disease, and healing, it's the same for me when it comes to bone metabolism. So, really, healthy living is healthy living. And my main purpose, my main message, is to give women hope and to show them what is possible. What do they have control over? Especially if they get a diagnosis like cancer, osteoporosis, something where it feels like you're out of control. And I really do think, Carol, that all that you've shared today and your vast knowledge, there is so much that is possible and there is hope. I love that message.
I support that 100%.
Yeah. Okay. So for ladies out there that want to learn more, that would like to find you, to see what it is you offer, what you're sharing, can you let us know how they can find you? What is it you offer? Maybe you have some things coming up or things that are in the works. I'd love to hear what it is that you offer.
Well, thank you. You can go to my practice website, which is my name, Carol Lourie, and it's LOURIE.com. I have a contact me button at the top. You can send me an email. I always respond to 100% to everybody's questions. I have another website called empoweredagainstrecurrence.com. That's for my live group coaching program. And I'm about to launch a smaller version of that, which will be self-guided. And so just reach out to me and let's see where you are, and we'll start with a conversation. I think that's the best way of reaching me.
The fact that you say that you answer everything personally makes me realize your heart is in the right place and that you're here to help women. And then a question about your live group. Is this like a membership? Is this ongoing?
It's a 6-week live coaching program. It's a 6-week live coaching program. We just had week number 1 last week, and week number 2 is tomorrow. We're meeting on Tuesdays from 11 Pacific for 6 weeks in a row. And we go through what I call the 5 steps of breast cancer empowerment: nutrition, targeted supplements, recovering from trauma, creating understanding and being able to speak with your oncologist about advanced functional medicine testing, creating a healthy and joyful lifestyle. And then the week number 6, by special demand, is called the special workshop, reducing side effects of tamoxifen and aromatase inhibitors. So within those 6 weeks of live coaching, you also get my 6 chapters or modules of my online program or library or vault that coincide and support all the information of the live coaching. And there's ebooks and meditations and expert interviews and referenced articles in there, all to support what we're learning within the 6 weeks. The program just started, but I launch that every month. And then we have the Evergreen program, which is the self-guided program. And I also offer concierge private consultation for women who are interested in that. So I'm really dedicated to supporting women at whatever level they can afford and that they're able to do.
Oh, I love that. That's exactly how I feel. I love that you're out there. This is so helpful. And anyone listening, Carol is your go-to for being your guide, giving you a plan to help heal with cancer and learn what is possible and what is necessary to heal. So thank you so much. Yeah, thank you. This was really, really nice to have you as a guest.
My honor, privilege.
Thank you so much for listening to Stronger Bones Lifestyle Podcast. Bone loss is not an inevitable part of aging. We don't have to just wait for it to happen. There is so much that you can do. And that is what you will learn each week on the show. Go to my website, DebbieRobinson.com, if you want more information about what was shared in today's episode. At the bottom of this episode in the show notes, there will be links to whatever was shared. Please subscribe to this podcast. Share this podcast with your friends, your family, or any women that you think may be interested or benefit from the information we're sharing. Please rate the podcast. And if you have any questions you'd like asked or answered, I would love to hear from you. Let's do this, ladies. Let's change the way the world views osteoporosis and slow down, stop, or reverse our bone loss, take charge, and show other ladies what is possible. Thank you so much for joining me.